Chip has been doing great work in our community to end homelessness for the past 20 years. But what's next?
I know in the future, our community is working to develop plans to end homelessness, and then we're breaking that out into certain populations. So to end homelessness for youth, a plan to end chronic homelessness, a plan to end family homelessness, and we're well on our way with the plan to end veteran homelessness. So CHIP is coordinating those organizations that will have impact with each of those populations, helping us to come up with that plan that's reasonable, it's specific to our community, and then again, setting goals in those plans that are realistic.
In addition to promoting best practices for community partners, CHIP is also initiating a program called Coordinated Entry.
Coordinated entry is something we're very excited about because it will take a lot of the luck out of homelessness. Right now, people can enter into the system of providers in a lot of different ways, and depending on what time of day, what moment you arrive, and who you go see affects a lot about the types of services you get. The idea behind coordinated entry is that we step back from individual agencies and we work together collectively to say, hey, how do we make sure that the people who need it the most are getting the services that we have?
CHIP is also working with the City of Indianapolis and Eskenazi Midtown Mental Health to create the Rubin Engagement Center, a state-of-the-art facility to connect people who may be suffering from addiction to service providers to help with treatment.
The Engagement Center has been a 30-year project where there's city money being invested into the issues of homelessness, directly from the city, not from a federal grant, not from some other entity, from the city, has committed to supporting the homeless by the Rubin Engagement Center.
And this will actually fill a really important gap in our system, and it will lead to more people being housed in stable situations.
In addition to all of this, CHIP will continue to provide research, training, and technical assistance to its service providers, as well as continuing to work with our elected officials to make ending homelessness a priority. CHIP has also created a collective data system into which all service providers can enter their data.
Now we have established community baselines, and going forward from this point forward, we'll be able to track how successful we are on that. How close are we coming to ending homelessness? How quickly are we reducing the amount of time that someone's homeless to when they get housed? How often are we seeing people that are coming back into homelessness? All those measures we'll be able to look at as a community. And I think that for CHIP to be able to take a leading role in that, it's really an important thing because individual providers wouldn't have the capacity to manage that, in that process.
I'm excited about CHIP being able to lead us in a direction that I really see will help us end homelessness in our community, and I really see CHIP as leading our community in getting there.
Going forward with CHIP too, some of the things that are really important that we think about doing, we want to make sure that programs are evaluated well and that we are doing the right research so that we are doing best practices in this community. And CHIP is really committed to looking at what's going on around the country and around the world and finding things that make sense and trying to bring them back here to this community, support them, germinate them, pilot them, and trying to find solutions.